Governor's spokesman Sean Gumatauta weighed into the GovGuam health insurance controversy today, slamming the Gutierrez-Ugan gubernatorial team for trying to make a political issue out of the increased insurance premiums for GovGuam employees.
8 people from our government, including a representative from the legislature, which happens to be the committee that the Lieutenant Governor candidate, Frank Ugan, chairs, and to say that he and his group did not know of these negotiations and the cost and the like is absolutely just insane.
The controversy was triggered by a full-page ad yesterday from the Gutierrez-Ugan team charging that health insurance rates for GovGuam employees were about to go up nearly 300%. Calvo's Select Care fired back today with a full-page ad of its own in island newspapers, setting the record straight, it says. The Select Care ad asserts that increases for the 2 Select Care plans offered this year range between 57% and 93%. But that's the combined premium that includes GovGuam's contribution as well as the individual premium from the GovGuam employee. However, as today's full-page ad points out, cash-poor GovGuam is limited in the amount that it can contribute to the new health insurance rates. So GovGuam employees' out-of-pocket premiums are actually much higher. Of the 20 options under the 2 Select Care plans offered, 4 require a premium increase above 200% for an individual employee. The other 14 plans have increases of under 200%, with the 4 remaining options reflecting increases under 100%. Speaker Judy Wonpat.
I've been getting calls from families, and these are the ones that they're really hurting, because they said that for a family of 3, they would have to put up $6,000 first before anything else, before they pay anything else. So it's $2,000 deductible per person.
The Select Care ad points out that the actuarial firm Aon Consulting reviewed the proposed rate increases and found them reasonable compared to the kinds of increases taking place elsewhere around the country. But Speaker Wonpat wants an independent examination of the rates, which, she says, is already required by law.
Let's implement Public Law 30-170, where then the actuaries will be able to go in and look at the books. So for every $100 that we give you, we want to see how you use that $100. How much of it is going to go to profit?
Either way, the Speaker says it's time to go back to the bargaining table.
I think the very first thing would be to get back to the table again, bring all the negotiators back to the table, and lock everybody in that room and say, you're not going to come out until such time that you've come up with, a better agreement.
We expect to sign the health insurance contract for our GovGuam employees and the retirees in the coming days. We want to ensure that they have the important health care that they need, and we're looking at every possibility to ensure that that does happen around and before October 1st.
Kevin Kerrigan, PNC News.